Hello, and welcome to the Hawaii Health Data Warehouse's Coffee Break Monthly Webinar Series. I'm Julia Chosey, a public health epidemiologist with the Hawaii Health Data Warehouse, or HHDW. And we're going to use the next 30 minutes to go through an overview of the hhdw.org website and its functions. It'll be a perfect introduction if you're new to the site or a good refresher for returning users. So we're going to review the different ways to find data that you need and show you some of the resources and tools that are available on the website. For those of you who know HHDW, you know that we actually have two websites that we use to accomplish our goal of making public health data available for the state. If you joined us last month, we did a review of hawaiihealthmatters.org. And if you missed it, you can check our YouTube channel for the video. This month, we're going to focus on hhdw.org. So HHDW offers several ways to explore valuable public health data. You can search the data by health topic area, or you can look at multiple indicators of health for a given community. One highlight of the site is an interactive data query tool that allows you to do detailed real-time queries on the 6 data sources that we house in the warehouse. This tool lets you dig deep into the data and create customized reports showcasing the data most relevant to your needs. Let's take a quick look at these 3 options for exploring the data. The first is health topics. So this module provides an overview of a topic and access to relevant data for the selected health topic. So this is a great place to start when you know your area of interest, but maybe aren't sure what data is available. Currently, there are 20 different health topics to choose from. We started with 10, but we continue to expand and we hope to add more. Here's a look at the current 20 health topics from alcohol to tobacco. When you select a topic, you'll see an overview of important information, including definitions, why the topic is important, what is known, who's at risk, and how to reduce risk. There'll also be links to relevant publications and resources, and there are several ways to explore the data that's available for the selected health topic. These include HHDW indicator reports, Hawaii Health Matters dashboards, customizable reports, and details about other data systems that collect information on the topic. Another way to explore the data on HHDW is using the Community Reports module. This allows you to see multiple indicators of health for a given community and how they compare to the value for the state overall. Currently, we have 3 communities available to explore. We have our 4 major counties, secular gender minority, and race ethnicity. So here you can see the options that are available for each community. HHDW worked closely with the Hawaii State Department of Health to select measures that cover a range of important health issues. So we ended up with 2 different sets of indicators, chronic disease and health risk. There are 22 measures in the chronic disease indicators, and they include topics like asthma, heart disease, and diabetes. And there are 27 health risk indicators, and you'll find data on topics such as substance use, healthcare access, and physical activity. Here's an example of a community report showing some of the chronic disease indicators for the Filipino community. We'll take a closer look at these reports during the demonstration. The last option is to go directly to one of the 6 data sources available on HHDW. This is where you can run your own analysis and build a customized report using the data query tool available on the site. Before we move into the demonstration, I want to give you just a brief overview of the 6 data sources available in HHDW so that you know what's available on the platform. The first 4 are surveys that are collected from adults, pregnant women, and youth, respectively. And the last 2 form the state's vital statistics, which are more like a census than a survey. They include every person in the population. Just briefly, the Behavioral Risk Factor Surveillance System, or BRFSS, is actually the largest continuously conducted health study in the world. It is operated by the CDC. It started in 1984, and now it's conducted in all 50 states, DC, and 3 US territories. Hawaii started administering the survey in 1986. It is a telephone survey that collects data from about 400,000 adults each year across the US. And here in Hawaii, we survey about 7,800 adult residents each year. BRFSS has a wide range of focus that is based on health status, health-related risk behaviors, chronic conditions, and the use of preventive services. Here are some of the topics included in BRFSS. So you can see a wide range of health issues. This is an incredibly important public health surveillance data tool. The next data source is the Pregnancy Risk Assessment Monitoring System, or PRAMS. It collects data from women who have had a live birth in the past year. Like BRFSS, it is maintained by CDC. It began in 1987 and is currently administered in 47 states, DC and Puerto Rico. Hawaii joined in 1999. And PRAMS uses a combination of mailers and telephone calls to get their data. They interview about 1,400 women with a recent birth every year in Hawaii. And since the survey respondents are linked to their baby's birth certificate, this is a great data source because you can also pull information from the birth certificate. PRAMS explores the experiences, attitudes, and behaviors before and during pregnancy and shortly after delivery. It collects data on a wide range of topics that can influence infant and maternal health, such as these topics shown here. Next is the Youth Risk Behavior Survey, or YRBS. This survey collects data on youth in grades 6 to 12. It is also maintained by the CDC in conjunction with the DOH and the Department of Education. Hawaii began administering the YRBS in 1993. It's actually two different surveys, so one for high schoolers, which are grades 9 to 12, and one for middle schoolers, which are grades 6 to 8. Although the surveys are very similar, there are some differences based on developmental comprehension of the questions. It is a confidential, written or computer-assisted survey that's given every other year to public school students in Hawaii. They collect data from more than 10,000 youth each time the survey is administered in the state. So YRBS focuses on health risk behaviors that contribute to the leading causes of death and disability among youth and young adults. So here are some of the health topics that are covered in YRBS. It's a nice complement to the BRFSS, where this is a public health surveillance tool for our youth. Next is the Youth Tobacco Survey, which was started in 1999 and Hawaii joined in 2000. It also has a national survey and smaller state surveys. However, support for the state level surveys was suspended after the 2019 collection year. So for this reason, the most recent YTS data we have for Hawaii is from 2019. There still is a national survey that's being conducted. We just no longer are able to pull data for Hawaii. But in the past, we talked to about 4,000 youth each time the survey was administered. So YTS is tobacco related, all things tobacco related, including beliefs and attitudes, media, cessation. So it was a very rich data set for tobacco use among our youth. Last, we have our vital statistics. So now we're moving away from the surveys. The vital statistics is the oldest health monitoring system in the US. It started in 1902. The Census Bureau was originally in charge of the data, but that responsibility got transferred to the National Center for Health Statistics in 1987. In Hawaii, the vital statistics data are managed by the Department of Health Office of Health Status Monitoring. You can see here some of the information that's available around data that's collected for births and deaths. So there are about 16,000 births every year in Hawaii. And through the birth certificate, we have information on the parents' demographics and characteristics surrounding the delivery. There's also information about prenatal care, birth weight, obstetric complications, and details about the infant's health. For the death certificates, we have information on the approximately 12,500 deaths that happen every year in Hawaii. This includes details on the deceased demographics, as well as information on the characteristics of death. In addition to the cause of death, we can determine information like autopsies and place of death and disposition. So just to give you a summary of the data sources that are available on HHDW, you can see here that the data that's available, it really covers the majority of the population of the state. So this really makes HHDW a valuable and comprehensive resource for public health data for the state. So just to summarize those 3 ways of exploring the data on HHDW, health topics can be used when you know your area of interest but aren't sure what data is available. Community reports are helpful when you want to see multiple health indicators for a given community and compare how they are doing with the state. And last, when you know what data you're looking for, you can go directly to the data source or build your own report where you can run your own analysis and build a customized report, showing the data in a way that's most relevant to your needs. Okay, let's go ahead and hop onto the demonstration. This here is, of course, our HHDW homepage. And you can see that there's a quick link to our other website, Hawaii Health Matters. And for those of you who are already familiar with the site, or when you do become, you can just jump right in here to build your own report. Down here, we have a little information about the website, and we do have some tutorials available to help you use the site. And then here we have our news and announcements. This is also where you can register for our coffee break. We have a featured content that we rotate every month that we try to focus on something particularly Hawaii related. And of course, our Instagram feed. But we're going to be focusing on these three options up here. So these are the three ways that I've talked about for exploring data on HHDW. We'll start with health topics. So here you can see there's a little bit of information. We do, again, have some tutorials, a brief one and a more in-depth one that can help you really get the most out of this module. These are the 20 health topic areas that we currently have. I'm going to take a look at disability to show you an example of what is available. So you can see here we have some definitions, we have some information about why it's important, and what is known, risk factors, and how to reduce risk. So that's also, it's a very good foundational information for the topic of interest. And then on the right-hand side is where you'll see what data we have available. So this starts with our Hawaii Health Matters dashboard. So again, this is our sister site. And what we've done is we've created custom dashboards for each of these different topic areas. So this one is disabilities among adults. And when you click on that, it will show you all of the indicators that are available on Hawaii Health Matters around that topic. So this is another great way to see what's available. As a reminder, there are data sources in Hawaii Health Matters that are outside of those 6 data sources that we reviewed. So sometimes when you're looking at those dashboards from Hawaii Health Matters, it might open you up to other data sources as well. We get into the customizable reports, and this is where you can see what's available from those 6 data sources. So let's, for example, look at caregiving. What you can see here is that all of the individual indicators that are available. And so if you click on one, it will bring you to this standardized default report. And I'm going to spend a little more time with this in a few minutes, but this is what you will go, this is the default report whenever you click an indicator. So that is what's available here in our customizable reports. You can see here we have indicators both in the death data and in the behavioral risk factor surveillance system. And then this last part here introduces other data systems that collect information on the health topic. So if you're interested in seeing other sources of data, it also links you to the Healthy People 2030 page that's related to that health topic. So that's also a very good resource. If you're not familiar with the Healthy People framework, it's worth looking into. Okay, so that's our health topics. Let's take a look at our community reports. So here I mentioned that we have 3 different communities. We have county, race, ethnicity, and sexual or gender minority. So here the default goes to our race ethnicity report, and it chooses the Native Hawaiians as the community for the report. But you can change that here to any of these other options. And this is where you can look at the chronic disease indicators versus the health risk indicators. So what you're seeing here, in this case, the chronic disease indicators are 22 indicators around things like asthma, cancer, blood pressure, diabetes, tobacco use, etc. And it gives you just kind of an overall snapshot of how this community is doing relative to the state. So for example, for this first one, for current asthma among adults, it's going to show you the data for the 3 most recent years of data. And this will give you the point estimate for the community under consideration. So this would be for our Native Hawaiian community. And it gives you the confidence interval. And then it gives you an icon that shows you how it compares to the state. So in this case, our Native Hawaiian community has a higher prevalence of asthma, current asthma among adults than the state overall. And you can see that is indicated here with the red frowny face. There are also ones that will be similar and ones that will be better. So again, this is just it's a good way to get a nice overview of a community. And if you click on one of these, what it will show you is a summary report. So this will show you that indicator. Again, this is current asthma by all 3 of those communities. So here you can see it's by race ethnicity. Here you can see it's by county. And here you can see it's by sexual or gender minority. There's also some additional information down here as far as, again, why this is important, the definition, a suggested citation, and how the numerator and denominator are defined. If you want to play further with the community reports, there are other data views that you can use. For example, you can focus on just one type of community, say county, or you can look at a complete report, which then also has the data tables. Let's then now move into our last section, which is our data sources. So I'm not going to be able to go through all 6 of them, and there are slight differences, but I'm going to try to at least go through 2 so that you can see an example of how this module works in HHDW. So we're going to start with the behavioral risk factor surveillance system. This is the landing page, so it gives you, again, a little background information on the survey itself. This table is a wealth of information. It tells you how many individuals were surveyed in the state each year. It gives you a link to the actual survey itself, so you can see the questions that are being asked. It links to our data release notes. So what we do every year is we make sure we note any new indicators or if anything has changed. So it's always a good idea to take a peek at the data release notes. And then there's also a link to CDC documentation, which is quite extensive. So if you need more details than you probably want, you can go to that documentation. I also want to point out that we work with the Department of Health to help people who have record level data requests. So if you're interested in doing any research on your own, analysis on your own, you can start that process here through the record level data request. There's also a report request. So if it's something that you're trying to find and you're just having trouble with it, you can always put in a request and we'll do our best to help you out. Okay, let's go to where we would build a report. So this is our health indicator selection page. And again, we get a little overview. Here's another link to those BRFIS data release notes. We also have a couple of options here to help people navigate what's available. So this is our content map. And what this is it shows you all of the indicators that are available on HHDW by their topic and subtopic. So this is a quick way to see all at once what's available. There is also an indicator index, which is very similar, but it is actually in Excel form, and it has a little bit more information than the content map. So that is handy, especially if you want to do some sorting or filtering. And then, of course, we always do a coffee break whenever we release new data for a data source. So this will link you to the most recent coffee break webinar. Okay, so here are our different categories. Within each category, there's often subcategories, and this is why that content map is very helpful. Let's go ahead and look at substance use. Let's say I'm interested in e-cigarettes. So I've navigated to my indicator here, and these question marks over here actually will let you see the definition of the indicator, often with the actual question that was asked. So that's very helpful. The first thing you'll notice here is that there are 2 options, crude versus age adjusted. And there is some information here too to help. My oversimplified suggestion is that if you're just looking at Hawaii, the crude rate is fine. If you are wanting to compare to other geographies, then the age adjusted rate would be better. But the bottom line is that these rates are very similar. So as long as you're clear about which one you're using, there shouldn't be a big difference. Okay, so this is that standard default report that I showed you briefly earlier. So what it will give you is the query criteria here gives you the definition of the indicator, and it's going to show you the 3 most recent years of data for the state by year. So here we're looking at ever used e-cigarettes among adults for 2021, 22, and 23. And as you see, you can get the data when you hover over the column. You can also scroll down here to the data table. So here we get our point estimate, our upper and lower confidence intervals, our count, annual estimated population, and a measure of statistical stability. So you can see here, these are all 3 are very stable estimates. Below this, there's some fine print. This is always good information to be aware that is there. Again, it gives you the question wording and some information about weighting. Again, a suggested citation and information about stability and etc. Okay, but for those of you who know this, you know that the power of the system really lies in the ability to modify this query. So let's go ahead and take a look. This is the query builder page, and it's got a lot of steps, and it seems a little overwhelming, but it's really not, because these first 7 steps are actually filters. So you don't have to do anything to them. They all have a default. For example, with age groups, it's going to be all the available ages. With sex, it's going to be both males and females. And then there's a whole array of demographic characteristics. So if you're interested in, say, a particular, say you're only really interested in data on the Japanese community, you can come in here and filter the data to show you just the Japanese community. Step 8 is where you tell it how you want to see the data. So right now we're looking at it by year. And so let's go ahead and take a look at this by race ethnicity. So now what we're seeing is the full population, all adults for the years 21, 22, and 23. And this shows the prevalence of ever having used an e-cigarette. When you see these little 3 dots, it means that you can actually do some sorting. So this is a case where it's nice to be able to sort it so you can quickly see the different race ethnicities. And then again, you have all your data. This can be exported to Excel. And so with that modified query option, that looking at the data by race ethnicity was just one option. You can actually look at it by all of these different dimensions. So you might be interested in people with diabetes or poverty level. And then the other thing I want to show you is that you can actually look at the data by 2 different dimensions at the same time. So now we're looking at race, ethnicity, and sex. So it's a great system, and you can toggle back and forth with the graph to see if you're only interested in one or the other. Okay, and then last, I just want to show you, of course, you can email, you can print, and you can share these results on social media. Let me just show you just quickly what YRBS looks like. So again, you've got this data table, links to all the different surveys. And in this case, when you go to build a custom YRBS report, you're going to see again links to those resources. And here we have the 2 different survey types, high school and middle school. Again, we've got our topics and subtopics. And here you can see there's no crude versus age adjusted in this case. That's only something that you see with BRFSS. But here we do have our geography selection located here on this selection page because YRBS is only available at the state and county level. So let's go ahead and I'm going to bring it back to our slideshow. So I'm going to put this up to give you some time to do a little hands-on work. Okay, let's go through these activities. So the first one is, what are the most common forms of cardiovascular disease? And I'm giving you the hint to go to health topics. So here we can see we will pick cardiovascular disease. And right up at the very top, it tells us these are 3 of the most common forms: heart disease, heart attack, and stroke. Okay, the next question is, what is the only chronic disease indicator in the community reports that shows the Japanese community is doing worse than the state overall? Okay, so we're going to want to go to our community reports. We're interested in race ethnicity, but now it's asking us about our Japanese community. And it is asking about the chronic disease indicators. What is the only chronic disease indicator in the community reports that shows the Japanese community is doing worse than the state? Well, that would be in a high cholesterol among adults. So we can see among the Japanese community, it's 31.9%. And for the state, it's 28.5%. Okay, the last question, what percentage of high school students used marijuana in the last 30 days in 2023? So here we're going to go to our youth risk behavior survey because it's asking about our high school students. We're going to build a custom YRBS report. And then it's asking about marijuana use among our high schoolers. So we're in the high school survey, substance abuse, and this was asking marijuana use in the past 30 days. So we'll select this, and it wants to know in 2023, what percentage of high school students used marijuana in the last 30 days? So we can see that answer is right here, 14%. And then this follow-up question is, what is the relationship with grades in school? So this is where we can modify our query. We're going to keep all those filters as is, but we're going to tell the system that we want to see it by grades in school. And now when we submit, it's going to show us this data, and we'll see perhaps not a super surprising result that with higher use of marijuana, there is more use of poorer grades. We don't know which comes first, but that association can be viewed here in the data. Wonderful. Let me go ahead and put up the answers. I want to invite you to join us in November. On November 4th, we're going to be taking a deeper look at some of the data sources behind hhtw.org and hawaiihealthmatters.org. It should be a really good webinar. If you have any questions, please contact us at profiles@hhtw.org. Thank you again for joining us today, and hope you enjoy the rest of your day.